Good evening, everybody, and welcome to tonight's webinar. My name is Bruce Stevenson, and I have the honor and privilege of chairing tonight's webinar with my all-time favorite speaker, I'm pleased to say, and he is joined by a fantastic guest as well. We're going to be doing things a little bit differently tonight. There is no actual presentation per se. What has happened is that John and Co have accumulated some questions that are commonly asked and require some elaboration and some discussion. So it's almost going to be a panel discussion kind of evening, which obviously we would love to include the audience. So if you have any questions, just pop them into the Q&A box. If you don't know where that is, just move your mouse over the screen. The little bar pops up. It's normally at the bottom of the screen, little black bar, and you'll see a Q&A box. Click on that, type them in there, and we will get to as many as we can tonight. No promises that we will get to all of them. But before we move on to that, I'd like to say a huge big thank you, as always, to Burgess for sponsoring this evening. Without Burgess's kind sponsorship, we would not be able to bring you these fantastic presentations. So Peter Lancaster, who's on with us, and we'll hear from him later. Peter, to you and your team at Burgess, a huge big thank you for the sponsorship for this evening. So I'm sure that most of you don't need to be introduced to John. John is an RCVS advanced practitioner in zoological medicine. He qualified from the Royal Veterinary College in 1990 and gained his RCVS certificate in zoological medicine in 2000. Until recently, he was employed as a small animal and exotic practice in Andover, Hampshire, with 100% avian exotic small animal caseload, both referral and first opinion, as well as consulting with various zoos and reintroduction projects. John now provides a consultancy and advisory service for zoos, local authorities, and vets. He's co-editor of 3 texts on avian medicine, 1 on rabbit surgery, and co-author on a textbook of tortoise medicine. Author of various book chapters and papers on a wide range of species. John was the president of the European Association of Avian Veterinarians 2015 to 2017, and on the editorial board of the Journal of Exotic Pet Medicine, the Veterinary Record, and the Veterinary Evidence. He was the president of the British Small Animal Veterinary Association in 2017 to 2018. And one of John's favorite achievements is that he's a trustee and honorary secretary of Vet Life. So once again, John, welcome. With John tonight, I'm pleased to introduce Matthew Rendell, who started in veterinary nursing career in 1989 with his experience in nursing care for many species from ants to elephants and most of the things in between those. He has been fortunate to travel extensively across the world as part of his roles. Matt has been involved in veterinary politics for many years and is currently an elected member of the RCVS VN Council. Matt is the chair of the AZEVN, which he helped to found in 2016 to provide CPD for nurses working in zoos, exotics, and wildlife species. Matt also is a member of the board of the ACOVENE, who help promote and support veterinary nursing in nursing education in Europe. So guys, welcome to tonight's webinar with a difference.
Thanks, Bruce. Tonight, actually, we should be saying nice things about you, Bruce, 'cause I think you got the most difficult job tonight.
What, keeping control of you guys?
Yeah, exactly.
Walk in the park, walk in the park. Right, let's kick it off, guys. One of the first questions that came in was, how do we approach euthanasia in rabbits from a welfare perspective, especially in cases where physical health is borderline, but mental well-being is clearly compromised? Long-term isolation, fear-based behaviors, those kinds of problems. And can you talk us about alternatives with the remaining bonded rabbit after the one has passed, and issues that may arise with single rabbit keeping versus the benefits of small groups?
Go on, Matt, you can kick off.
It's a really good question. I'm glad to have the opportunity to discuss it because I think we don't talk enough about euthanasia in rabbits. It's weird to start at the end, but I think it's a really important subject. I think the key thing in it is that not one approach will be successful in all cases, I think the practicalities of euthanasia is something we should talk about as well, if John's happy to. I mean, from the how we approach it in veterinary practice, because I think generally there's some gaps in there that can be quite end up with the rabbit not having a great end, and also being quite difficult for the owners as well. But I think the solitary rabbit question comes up a lot, and I feel like we should be looking at um, kind of behavioral cues as to how that rabbit is doing. Be considering that rabbit's welfare in the context of, is it a geriatric rabbit? Is bonding that rabbit again actually going to compromise that individual's welfare? You know, is it a rabbit that has advanced osteoarthritis? It's going to be a problem, and actually probably will have a prolonged period of stress to only have a very short period of time of being potentially bonded. And I think the key thing is with bonding, I'm pretty sure that most vets and nurses have no idea what it looks like. Two rabbits living together in the same environment is not bonded. It's just two rabbits living in the same environment. So I think sometimes we see lots of cases where the bonding has not gone particularly well. So I think we need to assess these things really on their own merits and look at them as individuals. In my experience, I don't shy away from owners that want to euthanize the second rabbit if the second rabbit is compromised and is not going to go through a reasonable quality of life during that part. I think, and this is where quality of life assessments need to be done routinely in older rabbits. When we get to a certain stage, then we need to be getting independent people or owners' friends or people around them to do those assessments, because the degradation of rabbits is very slow and very subtle. Being a prey species, they hide everything. So,
Matt, sorry to jump in there. Do you think that is an avenue that would best be filled by veterinary professionals? John, maybe I can pull you in there.
For assessment,
Yeah, for the quality of life assessments.
it's really difficult I mean, an outside set of eyes is actually quite useful. But both Matt and I'll be used to this in a zoo setting where you'd have a regular keeper assessing the animal all the time. Every now and then you put in an outside person to have a look occasionally and rescore and just recheck. But actually, overall, it's really difficult for vets and nurses to do that. I mean, certainly in the clinic, it's absolutely hopeless because the animal's frightened. They're not going to give off any right cues and stuff. And you're going to generally rely on the owner providing videos and photos and stuff, which are going to automatically have a little bit of selection about them, which can be difficult. So, and you could maybe argue house visits could be quite good, but again, animals will usually change what they're doing if a stranger comes in, especially one who's done horrid things to them in the past. So yeah, we have a role, but I think our role is teaching, and our role is educating people how to do this. And again, with quality life assessment is what are you looking at? And that's going to have to vary almost with every case because there may be different things wrong with them. And if you've got an arthritic rabbit, you maybe want to look at how it moves and how willing it is to move and stuff, whereas that may not be appropriate for some of the other conditions they can have. So it is important to do that. As a tool, a general basic one, there's a website called lapalove.com, and I'll talk about that again in a moment with regard to euthanasia. It's one probably Google carefully, but it's really good. It's very, very basic quality of life scoring system on it. And because it's so basic, you can adapt it really easily. And it's dead easy to use. And it's really good. And you just attach scores and people can see where that score starts to deteriorate. Or if you let's say, give analgesia, whether it starts to improve, because it's not just watch the animal decline, it's also look at your interventions. Have they actually worked? So it's a really, really useful thing to do.
Yeah, and I think what I'm hearing from both of you is the need for a joint team effort.
Yeah. Yeah. It's that talk to a client, isn't it, Matt? It's that keep talking. It's no good just giving a one-off lesson. It's got to be repeat. It's got to be follow-up. There's got to be interventions, and it does involve the whole team. And the nurses are probably usually better at this than we are because they've been taught more about it. It's great. It's a great thing for everybody to do and get really involved with the patient, with the owners too, and just make them feel backed up. And then I think, Matt, you said this when we were planning this session that too often people regard euthanasia as a failure, and it's not. It's a really
yeah,
good welfare tool. And I think
Yeah.
people really get it if you can just say, right, okay, we can do all this, we can see what we can do. And I think the singleton left behind animals are a really good one to look at. Is, you can quality life score. How is it doing? Is it doing as well as they think they are? Are they interpreting its behaviors correctly? And you can support them and say yes, no, and then really start to introduce the idea that maybe this isn't as good as they think. And do they really want their pet to suffer? And they don't. People don't want that. They actually want to. They want to do the best, and if that means saying goodbye, actually, most people are quite amenable if explained.
Yeah, and I think
Yeah.
it also comes down to guilt, doesn't it, Matthew? That
Yeah.
people feel guilty when they start talking about, letting both go together.
Yeah, I think having those awkward conversations is something that we're not very good at as vets and nurses. I think it's just having that ability to just bring it up in the conversation, and you'd be surprised how many owners are very receptive to it. The caregiver's bias thing that John has touched on as well is a massive problem in all exotic pets. Really, is that you really want your animal to be okay, so you kind of tell people it is okay, but actually you need to get some different perspective on it. But I think the key thing underpinning from an educational point of view is educating vets and nurses that euthanasia is not failure. It's not a bad outcome because it's necessarily, if it's necessary, it's the best outcome for the welfare of that animal. And I feel like we shy away from having that conversations, and often within the terms of contextualized care, if we're giving out, you see rabbits that are on 8 or 9 different medications, and you're expecting the owner to medicate that animal 3 times a day. Not many people have got time to that, and you're kind of setting the owners up to fail. And often you break that emotional bond they have with the rabbit because they're not able to do that procedure, and that's a whole yeah, a whole challenge. I think being really honest with the owners and giving them outs and giving them open questions that give them the opportunity to talk about euthanasia and their challenges, I think is, absolutely paramount importance.
Matt,
Yeah.
that's a really fantastic point. And John, I'm sorry to jump in there, but Matt has really opened the door beautifully to our second question, and it follows on what you were saying there, Matt. Was the question says, how can vets effectively educate rabbit owners about recognizing signs of chronic stress or poor welfare, especially in environments where rabbits are treated more like ornamental pets than sentimental companions? And again, it comes back to the single versus groups.
Yeah, I think it's one of those sad things where there's a lot of people we don't get to. And if you look at the PDSA poll report and it comes out, it usually gives a figure for how many rabbit owners say they've actually got a vet. And it's a depressingly low figure, it's usually around about just under 50%, isn't it? And so what you got to remember is the positive side of that is that the people who come in with surgery, they're the good ones. And you should be preaching to the choir. So you know that they should be on side, and it's just a case of really engaging and talking to people about their pets, about what they want, about what that pet's doing, but what it means. Um, and sometimes I think one of the good examples of that with long-term tonic immobility things, where people all kept showing picture of rabbits on their backs for hours at a time, and they weren't enjoying it. They're having a bad time and having to explain delicately. And Bruce Rader made a brilliant point about not inducing guilt. There's one of those things where it doesn't matter whether you're talking about an animal in chronic pain or an animal that's obese. That's a big one, that one. Or a single animal who's just freezing and not doing a lot, and that doesn't mean they're happy. That means they're frightened. Um, just don't make people feel guilty. You can't say things like you mustn't do this and look what you've done, and if you do this, this will go wrong, and the rest of it. It's a way of just saying, look, this is these are problems maybe associated. This is what we can try and do about it, but it probably won't be successful. But we can try this and try that and help you through this. But if you can't, we do have to start looking at this and introduce that subject gradually. So introduce the euthanasia subject just gradually as you can. And it can't be done in 5 minutes, and it can't be done on one visit. It's going to be repeated consultations, and that I think is why we struggle a lot of time, because with the best will in the world, it's difficult in a busy veterinary surgery. But maybe that's where we should be going to and looking at and how we deal with things more than just the nuts and bolts medicine and surgery.
I
Yeah,
think
yeah.
also looking for the flags from the owners. So if the owners come in and immediately say, "Oh, we bought it for our daughter and it's much more trouble than we thought it was going to be," those people are not going to be invested in that rabbit, and you can send them home with medications and you can explain everything. But lots of the times, those people will not do the medications and not be compliant at all. So you have to have those conversations. Whereas if you come in with people that have taken the time to perhaps do a welfare diary for their rabbit and bring in some video clips, and these things do take time. And I think exotic nurses have a really good part to play in this. We can tease out all of the actual information that vets need from the massive amount of information that comes into us. But um, ch choosing the bits of your clinical assessment that you get given to prioritize, I think, is really important. And if you've got an owner that's been bounced around veterinary clinics with rabbits, which happens a lot, no pun intended, they will often have been seen by lots of different people that not necessarily have come up with an answer for them or have perhaps listened to them. You know, you see a lot of rabbit owners that are very cued in with their rabbits and will bring it in and just say, you know what, she's just not right. And I think that's something that we need to think in the context of chronic pain. And John touched on it as well about trialing drugs. I mean, vets that are not that keen on it anymore, but in older rabbits that are just showing a kind of malaise and perhaps a reduction in appetite and activity, you have to think about it in the terms of, for me, that becomes palliative care. You know, you're not going to fix that animal, but you're going to give it a better quality of life. And I think just before handing over to John, you need to think about dental disease in rabbits in that same context. We don't talk enough about that being palliative care. We talk about we're going to have your rabbit in and do a dental, and then we don't necessarily say, but you know what, it's going to get bad again probably, unless it's an incisor removal. The chances are you're not going to fix it. So you're setting that owner off on a journey. And it is really important that we have that conversation at the beginning of that journey, saying, you know what, this is going to take some time, money, effort, and so you just have to make that assessment. And that's an awkward conversation, but it's very rewarding and improves animal welfare massively.
Yeah, it's that managing expectations. It's really, really important. I used to set up, we had a referral consultation for rabbit dental disease. And it's really sad because every time I think, oh, this is a person who's going to fix it. And my first words were, do you know I'm not going to make this better? And it's really important to get there. And about then you go into about what you are going to do and how you are going to manage it and what you're actually what you're aiming to achieve, which is not a cured animal, but one who's actually really happy having a good quality life. And that's what we're after really is that quality
Yeah.
of life really.
Speaking of quality of life there, and I think that's a fantastic thing is, you know, always set the expectations of the client. Navina has popped a question in following on what we were talking about, you know, saying goodbye to one rabbit or both in that. She says, what advice would you give someone with behavioral management with the rabbit that's being left alone if they don't want to say goodbye to both?
It's a tricky one. I would, yeah, I think you would have to say, look, these are the problems. You start off with this. This is the issue with that too. And do you want to go on? It's always that question to ask, and it's their decision, not yours. And then it's a case of, right, what is the rabbit like doing? What's his favorite things? It's a good time for an environmental assessment. And again, get some pictures, get some videos, if nothing else, to see, you know, is that rabbit got a good environment anyway? Because if it starts off with, it lives in a hutch at the bottom of a garden to start with, chances are it's having a bad time already. So, you know, you need to improve that a lot to actually get anything good with that. Is it a rabbit that's bonded to them? You know, you don't truly bond to people. That's a bad choice of words for me. But, you know, does it actually get on with this? Is it well socialized to people? Because if it's not, it's going to probably have an even worse time. If it's well socialized to people, sometimes you're not a substitute for another rabbit, but sometimes it does help. You can do a lot more with them. So you can start doing things like training and enrichment and things with you. So it's really a case of finding out about the people, what time they've got, what facilities they've got, what facilities and resources a rabbit has. Again, a bit about the character of a rabbit as well. You know, is it a nervous animal to start with? An extreme example, but you know, we would have occasionally have blind rabbits, and the companion rabbit was essential to that blind rabbit, and actually would guide them around and do stuff. Well, that's a rabbit is really very, very unlikely to do well, and most owners are already switched on before they reach that stage. So if anything happened to companion, that really was going to be hard to continue. So again, their expectation was managed or set before the companion died. So all those areas need to be looked at and then discussed on that individual basis, really, rather than
And
sort of, if you like, a hard and fast rule.
Yeah, I think encouraging owners to let the live rabbit see the dead rabbit is a good idea. I think it's a bit controversial, but some people just really shy away from that. And the living rabbit will go through a process of grief and loss. It's been with that. Even if you have a coffee table in your house that you don't like, you still notice it when it's gone. Now you don't have to be the best friend of that animal forever. So, but you will miss it, and giving that opportunity will speed that up. And explain to the owners that the rabbit is feeling emotional trauma from it and is going to go through stages that they need to support it through. So, as John said, enrichment is a bit overused. I think we kind of use it for an excuse for everything. This is a terrible environment, but it's okay. I've given it enrichment. But I think this is a really good example where you can use enrichment, and you can use food enrichment, olfactory enrichment. You can really change things and altering the environment. So making sure there's a chance for the animal to have more hidey holes, more visual barriers, and things like that is really important. But definitely explain that there is no way that you can remove that rabbit without remove the dead. No way you can euthanize one of those rabbits without the other rabbit getting compromised somewhere. It's just not possible. And again, we need to be honest about that. We don't have a magic wand that means that we can prevent that from happening. So talking to the owners about that is really important.
Yeah, I think you have triggered a real soapbox there, Matt, with the enrichment. I think you're absolutely correct there that enrichment very often becomes almost like a stick to prod things with and make them do something. And that's not the idea with enrichment. Enrichment is to basically enhance the experience and make their lives richer. Is what it says. And so, if they need to forage, give them some foraging. It's looking at a specific need they haven't got and providing a bit more of that, rather than just making them do something. Also, those pictures, don't you, of male antelope beating everything out of a bag of male antelope dung. And I'm not altogether sure they want to do that. But it's basically that providing that the right thing. So again, it's you've got to identify that right thing before you put it in there.
And by understanding what was going on before, you can't come in as a stranger and start dishing out advice when you don't know what environment the two bunnies together were kept in before the decision or getting close to it. And Matt, it comes back to what you were saying earlier. It's about, understanding the process. John, you also said be open and explain the road and the path that you're going to be going down.
Yeah, I also think it's a good thing too. And again, I hope Matt will come in on this one too. Again, it's back to this teamwork between vet and nurse. There are things that people will tell the nurses they won't tell the vets, and vice versa. And it's really interesting how people treat um, different professionals they're working with and they're happy disclosing. I wonder if it's come born of what you will tell the doctor or the nurse when you go for your own consultations. But that's why it's so valuable to have those. Not true safari system, but where you actually have those consult times where you do have a nurse around, you do have a vet around, and they can spend time alone with either of those. Because when we sit down together, you've got a lot of information you can put together, sometimes contradictory, but very often, adding to it.
I think that's a really good point. I think, yeah, that synergy between vets and nurses is really good for animal welfare generally. I mean, across the piece, but I think particularly in rabbits. And we just need to make sure that we're not setting the owners up to fail by saying, okay, coming back to the single rabbit, go to a rescue center and get yourself another rabbit. That's what you want to do. Two rabbits. I've read it in the book. Must be good. Two rabbits, two rabbits, two rabbits. But you need to make sure that they've got the environment that, as John said, they're not just in a hutch down the bottom of the garden in a dank kind of area. And also, you have to accept that the rabbit you've had all that time, you're quite bonded with. You might not like the new one, and it might not be so bonded, and you might kind of resent it a bit because it's trying to replace the one that you've had to have put to sleep. So the bond is definitely slightly broken with that. And then if the first rabbit dies, you're then stuck with a rabbit that you don't really like, and then you have to go through the whole process again. And we are very lucky that in my experience, the best rabbit nurses and vets are vets and nurses that have kept rabbits and have gone through that bonding process and know that it's not a linear pathway. There's a lot of subtle behaviors in it. It's not necessarily, kind of unicorns and rainbows. Sometimes it doesn't go well, and sometimes you end up with two rabbits, as I say, just living in the same environment. Sometimes it goes more smoothly. And John and I chatted as our kind of preamble to this about whether we should encourage owners to be having quads and more than two rabbits. And again, that comes down to resources. Don't want to compromise them by having four rabbits in an area with not enough resources for two. But it's definitely an interesting conundrum as to whether that's going to be better longevity as regards from the owners keeping rabbits and the rabbits' welfare for sure.
Yeah, I think that's always key, isn't it? That I do like group keeping rodents, rabbits. Everybody's heard these things, so will know. But you have got to have enough space, and you've got to have enough hiding places, enough food bowls, enough water bowls, and just like any group of animals, you can't have competition sites. Otherwise, you will end up with aggression and problems. Um, but it does get away from that always issue of always cycling through a new one and a new one and a new one and a new one, which gets really difficult.
Yeah, and I think that leads into the next question with a slight variation. You were talking about, pressure points and that. One of the other questions is, what about integration with predator species in the home? We're talking about new rabbits, but also existing rabbits, and then, we sight smells, those sorts of things, but also in the vet clinic, how do we make the vet clinic less of a predation threat to these furry children? And also pertaining to rescue centres.
Go on, Matt, you've done loads on this.
Well, I think it's I think we just need to be honest with ourselves what we can achieve in practice. So we need to have our prey and predator wards, or we need to have our bunny wards, and they need to be away, but they need to be fit for purpose. And we need to be very honest about what we're achieving, and we need to be aware of ourselves. So if you're covered in the hair of a cat and you stink of a tomcat, and then you're going in with your rabbit, not really thinking about that through. And we probably ought to call each other out on that a bit more and say, actually, do you know what? Do you want to just go and change the top, or do you want to kind of work your way around with that? I mean, it's important that we're honest. I was at a practice in Ireland recently where they recovered their sick rabbits in their staff room, and I was like, it doesn't make any sense. She makes loads of sense because it's away from all of the other animals and they get constantly monitored. So they're watched like I don't want to say like a hawk. There's the kind of contradiction there, but they're watched very carefully while they recover. And I think that's super important. I think use of things like Pet Remedy is important. I think also really timing your interventions properly. So prioritizing to look after your rabbits before you go into to look after your cats and dogs, and really kind of think about a service order so you're doing that properly. But just watch out for those cues. I mean, in an ideal world, you wouldn't have ferrets and rabbits in the same postcode. I mean, ferrets stink and rabbits have got very good smell, so managing that can be really difficult, really challenging. But again, be really honest with yourself. And the use of Pet Remedy, I think Pet Remedy has a part to play in this. I've seen it had good effects. I know the Pet Remedy people are gathering data to publish some stuff, but it's definitely, if it's available, it's definitely worth considering. So I don't think one size fits all, but the days of it being okay to have rabbits next to cats and things is just not acceptable. And I think space comes into this as well. And I know John's previous practice had really nice runs so that rabbits could actually move around. And it's frustrating when people ask for advice and they're trying to treat gastric stasis rabbits and they're keeping them in a cat basket. They're not really. They're like, I think about those horses with colic when I was a youth that we used to have to walk around to try and get them to do whatever they needed to do to get rid of that colic. So I think just be really, really try and evidence base what you're doing, but also be very honest about the resources that you have available to you. And that becomes complicated when you've got numerous rabbits.
Yeah, I think it's also a thing too. I mean, several things to bear in mind. One is, don't forget, especially for home environment, we are technically a predator as well. So if the rabbits are not socialized when they're young to being with people, that's quite a traumatic thing for them as well. Moving to a clinic, I think also familiarity is that big thing, isn't it? So you admit, obviously, the easy one is always admit the companion as well. That should be just automatic. The companion comes in, and if you're saying like has got a drip or saying, well, yeah, okay, fine. No reason why the companion can't be within sight, and sound if necessary of the one being treated. But if possible, have them in together. That's really important. But get people to bring in their favorite toys, their bowls, their drinkers, all the stuff that smells of them because it's gonna be pretty bad otherwise. And even down to silly things. If you haven't got mass number of cases, if it's a house rabbit, I would lay a bet the owner has the radio or television on all day. Think of all the senses. So, if it's used to a low level of, usually like test match special, I found, certainly soothe the vet. And yeah, have something like that in the background to just playing, just making another distractor, another familiarity thing. But full length for hospitalization is just start with the five freedoms. And I just don't think we ever really, certainly in my day, we ever really did that properly because, you got five freedoms. You can work through them and say, this is what a rabbit needs. And, you want to provide the environment or teach you about the environment. So you've got to start doing it yourself. Like Matt said, if it helps you have themselves. But actually, keeping them a clinic like you want the owners to keep them is not a bad way to go. So you can go through the diet, you can go through the living environment, but what's ideal. You can go through, preventing fear and distress and stuff and what's ideal. Now, then you're probably not, as Matt said, you're not going to achieve that in every single practice. It's damn difficult. We were lucky we had space and we can have several different wards, but not everybody can do that because we were a new build. We could design it from scratch, and it just don't always have that available. But you can at least then build in mitigators. So you can say, I want to do this, I can't do that. So I can compromise using this, and this will help hopefully mitigate those problems I can't fully conquer. So, and that might be the sky kennel in the staff room, which I've never felt is as bad as is one thing. It doesn't necessarily look lovely, but it can be really, really effective. And certainly for something like a dwarf rabbit, that may be enough space anyway. If you've got a walking kennel for dogs, they're fantastic for the giant rabbits, or any rabbit really. So, you can adapt and use and steal facilities from dog and cat colleagues.
I
That's what I
think,
do anyway.
yeah, I think also when it comes to owners kind of wanting to have a cat and a dog and a rabbit, it's really important to just be very honest with them. They should never have the possibility of being in the same space. Whenever owners say to me, "Oh, but the dog loves the rabbit. He spends loads of time licking the rabbit," and you're thinking, "Rabbit is not having a nice time there. This is not going to be a mutually enjoyable experience." But if the owners are going to have to, if they've decided that they're getting a rabbit and they already have a cat or a dog, they need to make sure that that rabbit gets habituated in a very safe way to that environment. So, just suddenly, if that rabbit gets exposed to that cat or dog by mistake once and it's never seen that cat or dog before, that's going to be absolutely terrifying. And that, in my experience, John might have experienced this too. That's where the owner finds the dog running around the rabbit's run, and the rabbit has died, and it's just had a heart attack, and it's just done it because it's been so stressful for it. Whereas if there's the very, very controlled exposure, if that's what the owners want, then that needs to be discussed as well. And I think you cannot. There is never a safe time to have any kind of carnivore in with a rabbit, and people do it. The same as dogs with tortoises. Tortoises are walking dog chews. I mean, they you can't really ever expect that to not go wrong. And again, I don't think we're particularly honest with that with owners.
I think it's that tortoise and rabbit thing is how many times have you heard, I've been fine for ages, and then suddenly, and it's something that happens with Q. And I mean, I know I've had sighthounds in the past, and any pet you had could just amble about in front of it, they're not in the least bit interested. If it turned and ran away, that trigger that hardwired response to chase.
Yeah.
And there's not a lot of a dog can do about it either. And it's just what the cues are given from each one, and it may not be advertently given, maybe totally inadvertent, and that can be a big problem. But yeah, it's as Matt says,
Uh,
it's about socialization, it's about mixing properly, and supervision because it will go wrong someday.
I think also just a final point in practice, we've all worked with vets and nurses that get scratched and bitten by rabbits. And in my experience, they've normally made that happen. They've normally just walked in, been a little bit fed up that they're being made to interact with a rabbit, and they interact in a way that the rabbit is not prepared for, and the rabbit reacts in the only way it knows how. And having been bitten by rabbits before, sometimes it can be a big surprise because you're not expecting it. But when those things happen, we need to make sure that we're discussing them because psychologically, that vet or nurse will be much rougher with a rabbit next time. I've seen this in bats in India, weirdly, that people that have had a negative interaction with a bat or a parrot or any bird of prey, it makes them much rougher with it next time because they really don't want to get bitten again. So we need to just look for that cue. So, okay, what did you do? Oh, okay, it just arrived. It'd been on a busy car. You see rabbits that arrive where they've been on the bus, and they're having a terrible time. So, giving that rabbit some time to just chill out in a dark, kind of cool environment, subdued lighting before you kind of go in. You can walk away and discuss the clinical history with the owner, get all your notes kind of taken down and things before you do that. but just watch for those things. They're not evil animals. I mean, we've all met those unspayed rabbits that are slightly evil and trying to turn into the devil's rabbit that run around trying to bite you and growl at you all the time. But most of the time that you will instigate, that will happen. You know, you will have made that happen. I think the more we talk about that, gives a nice way of getting a conversation about rabbit behavior with vets or nurses that are not particularly familiar with their care.
I totally agree with that, Matt. I mean, and it's that thing where it's that thing about reflection, isn't it? I know vets and nurses, we now don't like that term reflection, but it's a brilliant term. It is what we should be doing. And you look back at what you did, and you know deep down you triggered that, you caused that, you're in too much of a hurry, or you just did it wrong, or you're in bad, as you say, bad mood or whatever. It's what happens. That goes for almost any mistake, isn't it? Even if it's down to talking to the owner in a bad way. You deep down know that fundamentally it could have gone better. And that's just thing of accepting it, moving on, understanding it and not doing it next time. Otherwise, you say you get in a vicious circle. But these things always bite. Therefore, I must scruff it. I must do whatever else there. I must do all the bad things.
Yeah,
And all that
but
happens.
it's about
The animal
having
has a worse time.
it's about having an advocate to point that out. And you know, an
Yeah.
interesting couple of questions that have come through, guys, on this topic of integrating and handling and welfare, and that is the question of rehoming from. One question was from a laboratory, and the other one is, if a rabbit has been in a rescue center for a long time, is it fair to take it away from all those other rabbits and try and bond it to a new one?
Do you want me to go first?
Go
Um,
on,
yeah,
hot
go on.
potato.
Yeah.
I think the laboratory rabbits I saw pop up was New Zealand whites. New Zealand whites are they're as kind of familiar to rabbits as chickens are to birds. They're kind of their own thing. They're not really like rabbits at all. If you've ever worked with them, they are given such a baptism of fire that they kind of thrive or die. So the situations they find themselves in, because they're meat rabbits, if they survive that, they're normally pretty tough. I mean, I dealt with one a few years ago that had conditions that another like abscesses and things that another rabbit would have not survived. But the New Zealand whites they're just very different. They're often very quiet. They're often not. They're just completely different rabbits. So I feel like you need to just be really mindful of that when you're examining them and when you're looking at them. Their behavior to stress is very different. They're habituated to a negative impact with humans. They've been dragged around quite a lot when they're small. So I think it's important that we look at them with a slightly different lens, like chickens. Chickens are not really that familiar as birds. They're kind of slightly weird. And if you apply all of your bird knowledge to your chicken, you're going to go home scratching your head and very disappointed. And I think the New Zealand white is the same. I think it's a very different rabbit. And just a heads up, watch this in the literature, because New Zealand whites are often used in experiments, and it means that the literature that comes out from that you need to make your own assessment as to how valid and how robust that piece of research is, because they are very different. I don't know how many Johns, I'm sure you've dealt with lots over the years, but they are odd.
Yeah. Yeah. Actually, I always found them lovely patients. I always love the New Zealand whites, but
Yeah, I'm
they
fond of
are
them.
very different.
Yeah.
And I think you had a really great point about the stuff coming from lab data and stuff, because you think, oh, it should be so much data about rabbits and pharmaceuticals and things like that too. And it's actually irrelevant, because it just you got these very, very individual populations. And if you look at sedative doses when they first come out, they're really quite high. And that's because these young lab rabbits are used on. And then as we see them using pet medicine, usually you see the save rates fall and fall and fall. There's always a good reason for actually always making sure you use the latest dose rate. Don't memorize anything. Don't write down your set protocol, but keep reviewing it and keep checking it, because things like that tend to fall and change as they get used more in the pet situation rather than lab situation.
It's interesting, Matt, what you're saying about the different species and that sort of thing, or the different breeds within the species, shall I say, because it's not that different to owning cats and dogs.
That's exactly it. I mean,
I live in a flat, therefore I got a border collie. No.
Yeah,
Yeah.
absolutely. You every switched on to that, cats and dogs, different breeds are totally different animals and to totally different situations. And when it comes to rabbits, and we won't go into the other exotics where you change species, but when it comes to rabbits, it's exactly the same deal, and we should be again looking at do we want a very highly strung little dwarf rabbit, or do we want a more laid back dwarf or a really laid back giant rabbit, which is better in that situation and stuff? And we should be looking more at almost that breed basis.
I
And
think
again, extremities within that breeding as well, we should be worried about as well, which we haven't touched on.
I think when it comes to rescue centres, I think if you're a really, really good animal rescue centre, you shouldn't have any animals, i.e., you should be rehoming them or getting rid of them. And that always is a bit of a kind of strange comment, but it's true because you will have your ones that you are comfortable or not comfortable to rehome. So you've decided that actually their best place to live out their life is in that rescue centre. And I comes back to what we were saying about caregivers bias. I feel like we really need to make sure that we're educating ourselves on what that looks like because zoos are similar to rescue centres in they're really good places to magnify disease. I mean, if you want to get a disease through an environment, then put loads and loads of people that are really, really busy looking after lots of rabbits. So I feel like we need to be really kind of honest with ourselves with that, and also making sure that we do descriptors for that rabbit because some rabbit owners will really like grumpy rabbits. They quite like the rabbit that they will rescue that actually doesn't particularly want human contact, actually quite likes to just do its own thing and patches with another. And but having those open conversations and using descriptors that we're familiar with that do give the person that's going to take them on some insight into what it's going to be like to own that rabbit is really important because they do have real characters and different kind of behaviors and a lot of that will depend on what they've experienced so far. But having lots of rabbits in rescue centre is not ideal, and I'm sure John has experienced it as well, where VHD and other highly infectious pathogens get into that environment, and then it's very hard to deal with. Even fleas getting into that environment can be a massive problem.
It's really difficult at rescue centres because there are some really, really good ones around, really good ones. And people go into it because they really love the species, they really love the animals, and they really care. And they nurse them often through some really bad diseases. And if you nurse things, you can't help but get really close to them. So it's very hard to make decisions. And so, best will in the world, all of them end up with some slight sanctuary aspect, which is draining emotionally, it's draining financially, it's draining physically very often, and it can be a problem. And it's a problem with always with rescue places. I think back to your question was about where we're used to living all the rabbits things. I think if you come across a rescue place where they are genuinely like group keeping rabbits and they're genuinely living with other rabbits, then personally I would say, look, just don't take a rabbit away from there. Give the rescue place some money to look after them and go and see them once a week and watch and really enjoy rabbits being rabbits interacting with other rabbits. It's fantastic. But usually when they have lots of rabbits together, those rabbits, like Matt said, with the bonding, they're not actually living together. They might see a lot of rabbits, but they're actually just rabbits in different, maybe a couple of rabbits together, seeing a couple of other rabbits across the room type of thing. So they're not
That,
really living together.
yeah, that's opened the door really nicely. We've had a whole range of questions coming in about housing standards and everything else. And John, you mentioned just now about the five freedoms. There's one question that I think encapsulates everything that's been asked in all the others. I'm going to read it out to you. It says, what are the minimum housing standards we should be advocating for in companion rabbits, particularly regarding space, enrichment, and social interaction? Are the current RCVS and AVA guidelines sufficient, or do we need stronger recommendations in clinical practice? Exclamation mark, usable space.
Um, I'm happy to start with that way because I mean I've been working on RWA standards with it
Go
recently.
on.
And yeah, it's really difficult to say what minima are because it's not really very scientifically founded all the time. And sometimes you do just have to do your best. We can set some, and we're using whatever background knowledge we can get and whatever evidence we can find to set those. But it's not easy to find always. Very often there's a bit of opinion based in there as well. So it's difficult. What I would stress whenever you talk about minimum standards is it is the minimum standard. It is not a target. So the idea is you exceed it. And I think that's always the best. If you can exceed at a minimum standard, way better than just hitting that.
I
Matt,
think
what do you
I
reckon?
think I think also we have to be careful in welfare how we weight the metrics that we use. So we decide that size is a really good thing for welfare. So right, so let's give this rabbit a football pitch. but actually there's only some refugia and hides at one end, and its food bowl and water bowl are at the other end. Well, it's farcical, really. But we need to just back it up with watching that animal's behavior and just seeing what it does and what it's using. And rabbits that have lived indoors and then are put outside often are really kind of not keen to not have anything above them. This is something that John and I talked about the other day as well. So we've decided, because it suits the narrative, that actually a giant enclosure is really good for a rabbit. And as John says, we are talking about minimum things here. We should be providing the best we can, but that doesn't want to be a sterile environment that's not behavior. Rabbits like to hide, they like visual barriers, they like to dig, they like to graze, they like to get on top of things. They see that as vantage points are really interesting for them. So all of those things need to be taken into account and not just be thinking it's a massive enclosure. I'm giving some enrichment, therefore I'm providing a good rabbit environment. So we really need to take the time to look at what the rabbit does in that environment. I think that's super important. And different rabbits will do different things depending on what they've done and how their kind of physical condition is.
Yeah, Matt making a great point there about things like drinkers and bowls and stuff. It's been one of my, again, another soapbox. There are so many soapboxes. It's the joy of getting old. But, where do we put water bowls and water drinkers especially? We put them on the outside of a cage, right where it's easy for us to change it. And then so when we're dealing with things that involve lack of drinking, like, urinary sludge and calculi and stuff, we say, oh, yeah, guinea pig or the rabbit isn't drinking enough. Well, it's got to step into the light to get that. And it's got to be pretty thirsty to come out from its nice little hidden refuge into the middle of nowhere, to come right to the front, very, very front of that hutch or that cage, and pick and get some water. And I think it's one of the reasons why one of the triggers I often saw for gut stasis was when you had a rabbit whose hutch was moved. And suddenly, one they got a different view anyway, so a bit scared. So they're going to go to the back anyway and sort of kind of look out from there from a safer place they can do. And that's going to make much less likely to come forward and start drinking. And a really good trigger for gut stasis is being slightly dehydrated. So I think that's part of the reason why we got that.
Yeah, and I think it comes back to the five freedoms that you were talking about, John. And I think I just want to point out here, folks, for those of you that are interested in these wonderful little creatures called rabbits, John has actually done loads and loads of webinars on all sorts of exotic species. But go onto the Webinar Vet website and go and have a look. You can either search by John's name or you can search by rabbits, and you'll see there's loads and loads of information. And a lot of the questions are coming in there are whole webinars already that John has already covered. Matthew, jumping.
Matt, I open to hire if you want another one of these.
Matthew, talk to us about the Grimace scale.
Yeah, I was pleased to see a question pop up about that. So I think sometimes we're maybe overusing Grimace scales now. Now, this may be not a popular thing to say, but if in your experience as a vet or a nurse, something looks painful, it's probably painful. So, we know from other species what is painful, and rabbits don't really deal with pain very well at all. So, if in doubt, in my honest opinion, give painkillers. If your Grimace scale is not particularly indicating that that's the case, maybe it's just that rabbit is showing that distress differently. I feel like not all rabbits have read the Grimace scale and know exactly what they're supposed to do. And also, all of the Grimace scales, I don't know why, always seem to be on white animals, which makes it really hard for you to do. And I know some are done on New Zealand whites as well, which again react very differently. So I think it should be in our toolkit. It should be part of our kind of associated things. Yep, let's do that quantifiable Grimace scale. That's a really nice thing to do. But also just do clinical discussions around these cases. So if John and I have got a rabbit in that we're not sure, let's look at it without each other, and then let's come together and talk about it. What did you think? Well, I thought actually, you know what? It was dribbling a bit, and it was looking, and it didn't look comfortable at all, and it was hiding at the back, and it was that. Look for those cues, and each person will see that differently. But try not to just use. It doesn't start and end with the Grimace scale. The Grimace scale is not a get out of jail card that you can just use. Well, the Grimace scale, it was fine, so I didn't give it painkillers. Really, really do think about that. And that's, for me, that's particularly interesting and important with gastric stasis cases. I think they often are in a lot of pain, and if you get that pain under control, you'll often see really, really good results. That and fluid therapy, I think, is key. But yeah, just wanted to just make sure that people are really thinking about how they're using that scale.
Can agree more.
John?
It's like every other tool you have in the box, whether physical or mental tool. If you don't use it correctly, you're going to get some very dodgy results. Same as doing lab tests. Don't treat the numbers, just treat that whole animal. Look at the whole animal. Really, really important there. And yeah, the example I was using, I think I told you when we were warming up, Matt, was most extreme one I saw was we had two people do grimace scores on the same rabbit, and they got really wildly different. And we looked at it and had facial palsy. So one side of its face was paralyzed. And of course, he gave a very different score to the other side of his face. It wasn't. So,
Yeah.
you've got
And
to
I
be
think
really careful to pick your cases of these too. Some of the physical illness will change it too.
and I think this we're talking about acute pain here as well. And I think the chronic pain stuff, we're just scratching the surface. There's a vet nurse on this webinar called Cassie Morrison, who, if you're not aware of her, is doing loads of chronic pain stuff in rabbits because like most other species, we're quite good at acute pain, but we're really lacking in our kind of dealing with chronic pain. So um, I'm sure she won't mind saying, but that's driven by her being a rabbit owner and not necessarily getting people understanding how important it is. We're looking at that kind of quality of life, trying to maintain an acceptable quality of life in older rabbits, I think is really important, and getting owners involved in that process.
That brings us into the next question. Matt, you're opening up the door to all of these questions for me. Thank you so much. In terms of preventative health, how does inadequate diet and environment contribute to the common rabbit welfare issues such as dental disease and GI stasis? And what role can the vets and nurses play in trying to educate and change owners' behavior?
Do you want me to go first?
Go on, Matt.
I think it's education. The education all the way and having good communication with owners. So often they've bought the rabbit by the time you get to speak to them. So that's difficult. And try not to beat them up too much because otherwise they just won't come back to you. If you just tell them that they're an idiot for buying a giant breed rabbit and they've got a small thing, you're missing that opportunity to educate them. So try and gather them in. Tell rabbit owners if you own a rabbit, be completely open when they say, "Oh, I've got some rabbits at home." Same as with snakes and birds; those people will immediately bond with you better. And just really just focus on the things that are of paramount importance. So, diet, exercise, for me is key. We're very lucky that we work in an environment now where we have decent rabbit foods, and we understand much more about rabbit nutrition, and we understand much more about metabolic bone disorder being probably underlying a lot of dental disease, and it probably starts from the get-go. But as an educational tool, we just need to educate our own professions so that we're in a good position to educate the public. And I always talk about this thing called the velvet mallet. So you kind of beat owners up a little bit, but not so much that they kind of realize it. So you kind of say, "Oh, you've decided to buy a giant breed rabbit. Do you live in a castle, or what, how are we going to kind of deal with this?" But actually kind of get them involved and make them realize that you can make the best of that situation by supporting them. And I think that's really important. Don't attack the clients, try and educate them from the start. And I think, as John said earlier, about having those safari consultations for vaccinations, I think is really useful. So vet does their clinical examination, does the vaccination, does the card, and then, right, okay, if you wait here a second, one of our rabbit friendly nurses is going to come in and just chat for you about the other stuff. There's lots of opportunities for people then to air any concerns and have a really good conversation and bond with your practice and with that vet nurse and the vet, and feel that they're getting value for money, and you will engage with you. And as John said, we see such a low number of rabbits that are kept in captivity in vet practice. People just don't take them to the vets. And that's because we've not got that balance of education, and we're not seen as being particularly helpful. I mean, we still have a lot of vets that don't understand rabbits at all and just give them Baytril regardless what's wrong with them, and build owners' expectations before referring them. And this is a big problem in referral: is they send you rabbits that you just can't fix, and they've been promised things that are not achievable. And again, that's all down to us educating the people around us, and then in turn educating the owners.
John?
Yeah, I think that's absolutely correct. And also that thing about don't forget to reach out to the pet shops. There's a good bit of record a few weeks ago about how these are the places where they do have to implement all the rules. And it makes sense to support them anyway, because that's where you like to give a higher standard, some of the higher standards of welfare for any of the animals sold rather than unregulated sales places. But for us, that's where a lot of the patients are going to come from. So reach out to them. That's when we're going to get to the people who wouldn't necessarily come to a vet or might go to a vet who knows less about rabbits than we do. So it's all about liaising and talking, and again, try to not to. This is rich after I've been banging on for half an hour, but try not to preach. I really should do that myself. But you don't preach at them. You know, you engage and talk and discuss. And you do find out a lot. And actually, a good example, that's bonding. You know, some of these people do a lot of rabbit bonding, and they're very good at it. And it's just to get some tips, get some ideas, get what they feel as well. There's a lot we can learn too by talking to people who've lived and worked with rabbits all their lives. So it is just engage, just talk, communicate, listen, and yeah, and try and get to as many people as you can. And you're not going to do that by hacking them off on the first consult, as Matt just said.
Yeah, I think that's really important. Work with the clients and talk with the clients, not at the clients. And as vets and nurses, if we feel our knowledge is lacking, attend CPD. As I said just now on the webinar vet, there's loads of stuff, John, that you've done for us that is invaluable. And also that, of course, the other thing that people can search for, which is going to bring them huge value, is on the Webinar Vet website, Burgess. Burgess sponsors a lot of the good stuff that's happening, and Matt mentioned it about knowledge on nutrition and everything else. And I think I'd like to take this opportunity now to bring Peter in from Burgess. And Peter, if you can share your screen with us and just run through some of the exciting stuff that Burgess is doing for us at the moment.
Firstly, just to say thank you to Matt and John. And I think 99% of what I'm going to say has actually been covered. So I consider my thunder duly stolen, but in a really good way, because it does show that we have some alignment and some shared themes. And these are not my opinions. I think as a company at Burgess, everything that John and Matt have said around not preaching, not beating people up, and trying to get people to do the right thing in a positive way is what we're trying to do. With Rabbit Awareness Week, which is kind of started yesterday. Today's the second day. We've been running Rabbit Awareness Week for 19 years, and we kind of covered over those years lots of different themes. And you can see some of those here. I won't go through them all. But we kind of rotate and go through those 5 welfare needs. Trying to educate people and get them to do the right thing in a positive way. I think, I can't know if it's John or Matt, so forgive me, talked about the PDSA PO report and actually that being a useful source of information. And when I look at some of the numbers that we get from them, I think we've made some good progress in terms of certain areas. So in terms of getting people getting the owners to feed their rabbits enough air, we've made good progress there. And you can see just how, there's 15% last year were not feeding kind of enough air. And in terms of muesli, again, we've made good progress over the years. So that's down to about 17%, I think it was last year, slightly up. But in terms of the true number, it's declined. There's a kind of margin of error in that. What I will just say is that I think there's a risk of us plateauing, certainly on some of these measures. And again, if you look at that muesli one as it's gone down, the gains have got less and less. So that's one thing that we need to look at. In other areas, we've still got some work to do, and the number of rabbits in inadequate housing, we haven't made such good progress on that. There's a link there, and I think they'll put it in the chat, which is Rebecca will put that in the chat, which is a paper just published last month, and I think it's by Lauren Fenton, and that said that it was a survey of mostly UK vets and specialists, and inadequate housing was the number one welfare concern for those people. So we've still got a lot of work to do there. And also in terms of the percentage of rabbits living alone, which we've talked about earlier, again, the progress hasn't been this significant. So we do have some work to do. and we continue to do that. So this year's theme was happy homes, and that gave us an opportunity to talk about, Ronnie, day 2 of Rabbit Awareness Week, we will talk about the environment, companionship, health, diet, and behavior, because all of those go into making happy homes, healthy homes for these animals. And I know a conversation I had a number of years ago with John about Rabbit Awareness Week, and we should be aware every week, but Rabbit Awareness Week does give us an opportunity to reach out to the media and get some focus and some coverage that we wouldn't actually get otherwise. And one of the things that I would ask people to do is outreach. And again, John mentioned this, people who are coming into practice are the good owners. Both Matt and John said that. So we need to get to the people who are not coming into practice. So, you know, we have the local community, social media, run events. Back in the start, we used to encourage people to do free clinics, and we don't want to really do that. We don't do that so much now because it kind of devalues the work that you guys are doing, but it's still an option. Reach out to your local news. There's more and more local news websites. There's local radio, and then there are partnerships. And again, John mentioned this: work with your local retailers and work with your local rescues, because those are the people who are going to see more pet owners, more rabbit owners than potentially you're going to see in clinic. And again, just in terms of some of the things that you can do, don't want to get into the debate about size and all that we talked about, the right amount of space. But this is a really interesting post that's from a couple of years ago, just doing something a little bit strange, just to highlight the what we're trying to do and the messaging around Rabbit Awareness Week. So a local practice to us in Yorkshire, in Brighouse. That kind of thing will help get engagement and help get these messages across, and reach those people that we don't reach because they don't come into practice. And if it's not enough just to do good work, because we like to do good work, there is an Excel Vet Award for the Rabbit Awareness Campaign of the Year. So if you need an incentive to get involved, there is a prize for the best campaign, and I would encourage people to enter that. And then we can recognise the great work that you're doing and celebrate that. And then I saw one of the questions earlier on was, is there something about guinea pigs? So a quick pivot, just in terms of guinea pigs. We have the Guinea Pig Welfare Forum in the 10th of September, which is going to be chaired by John, following from a fantastic first event last year. If you scan that QR code there, that will take you through to the link to be able to purchase a ticket. We are charging £10 for the tickets this year, but that money will be donated to Guinea Pig Welfare Charity. So it's not going to Burgess. And as always, if you need any literature or support material, you can see our email address there, vetsupport@burgesspetcare.co.uk. And we'll happily send you out as much information as you need to help educate your clients to look after their rabbits and better. Thank you.
Thanks, Peter. Please leave that slide up so people can get the benefit from it. Much appreciated. A huge thank you to Peter and to Burgess for their sponsorship for tonight. We really, really do appreciate it. And I know we've worked together a lot with John over the years and Burgess, and it really is a fantastic organization. Loads and loads of CPD that John has done with Burgess. And Peter, thank you so much for your generous sponsorship. John, Matt, thank you. It's been lovely having you on. It's been a great debate, and there's been some really interesting points raised. And just remind the folks, we have recorded this webinar, and it will be up on the Webinar Vet website in the next day or two. So if there is something that you want to go back to and listen again, the recording is there and you can do that. And while you're there, have a look at all the other Burgess and John Chitty CPD. It really is fantastic stuff. Matt, welcome to the team. This is a very high bar that you've joined up at, and you've more than met it. So thank you for your participation tonight. John, as always, thank you for being so amazing. I really do love listening to you. To everybody who attended the webinar tonight, thank you for your time. We really do appreciate it. And to Beck, the controller in the background, who made everything run smoothly, thank you very much. From
and
myself,
a final thank you to Bruce, please, because Bruce chaired tonight and really, really did a great job. Thank you so much.
Thanks, John. From myself, Bruce Stevenson, it's good night.